tips for preventing hematoma and infection after pacemaker implantation. Work done by Professor Samir Rafla, Muhammad Sanhouri, Muhammad Al-Fiqi, and Shiruq Ramzi, Alexandria University, Faculty of Medicine, Cardiology Department, Egypt. Pocket hematoma is a recognized common complication after placement of a permanent pacemaker or implantable cardioverter defibrillator. A pocket hematoma is associated with a local discomfort and an increased risk of infection and may require surgical intervention. Future applications in recent trials, pocket compression vests were demonstrated to lower risk of pocket hematoma and infections in patients having device implantation. The aim of the work was to study and identify the clinical factors associated with hematoma formation after pacemaker or ICD device implantation and how to prevent it. 50 patients constituting group 1 were subjected to local measures such as electrocautery of any bleeding spot and intrapocket hydrogen peroxide application before closing the suture. 50 other patients, group 2, were implanted with device during an era when cauterization was not available or not used, and no such solution was considered at that time. Patients were prospectively enrolled in a study after successful completion of device implantation. Patients were identified with hematomas, were followed daily while hospitalized, and contacted by telephone after discharge. Subjects of this prospective study were 100, divided into 2 groups. Clinical characteristics and use of anticoagulation and antiplatelet drugs were documented. All pacemakers and defibrillators were placed by experienced physicians. Anticoagulation therapy was not altered. Study protocol. Hematomas were categorized into 3 groups. Type 1 did not extend beyond 1 centimeter past the device margin. Type 2 hematomas extended beyond 1 centimeter past the device margin and caused significant strain on the incision suture. Type 3 was defined as device pocket hematoma that necessitated interruption of anticoagulation therapy or further surgery as hematoma evacuation. Hematomas were treated with external compression, temporary discontinuation of anticoagulation if not contraindicated, and rarely with course of antibiotic if local cellulitis was suspected. With this approach, device pocket hematoma occurred only in 4. There was no significant difference between the type of the device in the 2 groups. Results. Group 1, 50 patients, 45 of them did not have hematoma. The other 4 patients developed hematoma type 1, mild, and 1 patient hematoma type 2. In group 2, 50 patients, 9 developed hematomas, 5 type 1, 2 type 2, and 2 type 3. No infections had happened except in 1 patient. So the use of electrocautery and the intrapocket hydrogen peroxide were beneficial in preventing hematoma. This is the table of the 2 groups. The incidence of grade 3 hematoma was 0 in group 1, 2 in group 2, 1 case only grade 2, and 3 cases in group 2. Finally, no infections had happened except in 1 case in grade 3 hematoma. Total types of 2 or 3 in the patients were 6. Total, all the 100 patients, 6 cases of type 2 or 3, that's 6%. In conclusion, the use of electrocautery and the intrapocket hydrogen peroxide were beneficial in preventing hematoma. Thank you.